Nefiracetam is a fat-soluble nootropic in the racetam class of compounds. It's considered more potent than the original piracetam. Nefiracetam was developed in the 90s as a treatment for cerebrovascular disorders. In 1999, nefiracetam was in a phase 2 clinical trial in the US for the treatment of cognition problems as a consequence of stroke and Alzheimer's type dementia. It's similar in structure to piracetam, with a phenyl group and 2 metal groups added to the amine of piracetam. Nefiracetam, like all racetam nootropics, has a pyridine nucleus at its core. The structure of nefiracetam is similar to aniracetam. Nefiracetam is used as a prescription drug in Japan, and it's sold as a supplement in the United States. It's relatively new to the nootropics community. Neurohackers use nefiracetam to boost learning, cognition, and memory. It helps to control NMDA signaling, and this protects against excessive glutamate levels. Glutamate is a powerful excitatory neurotransmitter, and too much glutamate damages the neurons and the entire brain. Nefiracetam modulates GABA levels in the brain, reducing GABA when it's too high and increasing it when it's too low, producing a calm-like focus and reducing anxiety. Nefiracetam prolongs the opening of calcium channels, keeping neurotransmitters active for longer, improving memory formation and recall. Nefiracetam potentiates nicotinic acetylcholine receptors, boosting the release of GABA and glutamate, producing a calming effect while also improving neuroplasticity and boosting learning and memory. Nefiracetam is a cholinergic compound. This means it affects acetylcholine levels in the brain. It's used as a prescription in Japan and sold over the counter in the US, but it's not a dietary supplement. One of the most recent synthetic nootropic compounds, it's known as a cognitive enhancer, and it's known for its anxiolytic or anti-anxiety effects. It's considered to be much more potent than piracetam. As a nootropic, it helps to increase attention span, alertness, cognition, learning, and to boost memory. Nefiracetam is fat-soluble, while piracetam is water-soluble. Fat-soluble molecules can cross the blood-brain barrier more easily than water-soluble molecules. Both nefiracetam and piracetam are cognitive enhancers, and both have neuroprotective qualities. Both racetams are able to improve learning and memory, and both are able to prevent brain damage. Nefiracetam has additional benefits that are not shared with piracetam. It can reduce anxiety and depression, and it exhibits several other memory-enhancing qualities over piracetam. It increases the amount of time the calcium channel in the neuron remains open. The calcium channel pathway is critical for long-term potentiation and the formation of long-term memories. Nefiracetam also potentiates protein kinase C-alpha, and this is involved in long-term potentiation. Finally, nefiracetam potentiates acetylcholine receptors in the hippocampus, and this encourages glutamate release and long-term potentiation. Piracetam doesn't share this memory-enhancing quality. The bottom line is nefiracetam seems to be a much more potent memory enhancer than the original nootropic piracetam. In several studies and clinical trials, researchers have noted nefiracetam's anti-amnesia effect, and they've arrived at this observation by noting nefiracetam interacting with individual acetylcholine receptors in the brain. One study conducted at Albert Einstein Healthcare Network in Philadelphia worked with older rabbits. The rabbits were used to study age-related memory disorders. In this case, the team used nefiracetam to study the effects on retention and relearning. The scientists administered 5, 10, or 15 milligrams per kg of nefiracetam to 34 retired rabbits over 15 days, and then tested the retention and the relearning 1, 5, and 12 weeks post-training. The researchers found the effect of nefiracetam on the ability of the older rabbits to relearn was apparent up to 5 weeks after using the nefiracetam. In other words, nefiracetam had a significant effect on memory long after the rabbits stopped using it. The researchers concluded nefiracetam likely has an even greater effect on memory the longer that you use it. Nefiracetam enhances the signaling of GABA on GABA A receptors when GABA is too low, and it has a suppressive effect when GABA is too high, leading to stabilized mood and sociability and no mood swings. Nefiracetam also provides an antidepressant effect by activating an enzyme CA-MK2. Scientists in Japan worked with mice with depressive-like behaviors. The mice were given 1 mg per kg per day of nefiracetam, and it was noticed that there was antidepressant effects within the first day of supplementation. This antidepressant effect takes a completely different approach to controlling depression when compared to SSRIs. These prescription antidepressants mess with serotonin levels in the brain to control depression, and they come with a host of side effects. Glutamate is an excitatory relative of GABA. While GABA has a calming effect, glutamate stimulates. Glutamate is the most common neurotransmitter in the central nervous system. Nefiracetam reduces anxiety, but glutamate is actually toxic to neurons, and too much of it in your brain can kill brain cells. Lou Gehrig's disease, for example, is caused by excessive glutamate. But glutamate is a pivotal neurotransmitter in the brain, and it links the brain circuits that are involved in memory, learning, and perception. Too much glutamate can kill neurons. Too much GABA can cause brain damage. Too little GABA can cause depression. Too little glutamate can cause problems with memory, learning, and perception. All of these changes can happen at any age, and they can be a product of the food we eat, what we drink, our lifestyle habits, the air we breathe, and more. So nefiracetam can help for age-related cognitive decline, as well as students who are looking to do better in school, by boosting acetylcholine and by controlling the glutamate and GABA in the brain. Nefiracetam modulates the GABA in the brain, and GABA is the primary inhibitory neurotransmitter. Its role is to keep glutamate, the primary excitatory neurotransmitter, from overwhelming the brain and causing damage. When GABA levels are too low, you experience anxiety, insomnia, poor mood, and restlessness. Left unchecked, it can lead to neurodegenerative diseases and a very poor quality of life. But when GABA is too high, you have a toxic environment in the brain, and this causes damage to neurons and other areas of the brain. Nefiracetam modulates the GABA levels, keeping them steady for a healthy brain, and it improves long-term memory. It contributes to learning by enhancing the long-term potentiation, enhancing the NMDA-dependent long-term potentiation at low concentrations, and AMPA-dependent long-term potentiation at higher concentrations. Nefiracetam combined with choline boosts the production of the crucial neurotransmitter acetylcholine, improving memory, recall, and focus. It's fat-soluble and it quickly enters the brain after you take it. Once in the brain, it boosts signal transmission and it protects the neurons. It boosts acetylcholine, so you should always add a good choline source like alpha-GPC or CDP choline. Several studies have noted that short-term or one-time use of nefiracetam doesn't do much, but supplementing nefiracetam every day for a week or more is needed to experience the full benefits. Users report nefiracetam provides calm focus, recall, and cognition. It improves attention span, motivation, and it alleviates apathy and mental fatigue. The visual effects of nefiracetam feels like your brain is processing a broader spectrum of what's in your visual range. Nature and your surroundings look more vibrant and beautiful. Many users report a calm focus and being able to articulate thoughts and improved speaking ability. Language and your vocabulary seems to flow effortlessly. Thoughts and ideas come with less effort. Some experienced users of aniracetam say they prefer nefiracetam. You may recall the chemical structure of nefiracetam is very similar to aniracetam, and the clinical studies support its superior ability to affect memory. You should be able to experience the full effects of nefiracetam within 1 week of taking it. It's fat-soluble, so it's digested and enters your cells quickly. Clinical trials for nefiracetam have been conducted in China and the US for their use in treating Alzheimer's. So far, no large pharmaceutical company in the US has formulated a prescription drug version of nefiracetam. Researchers at the University of Iowa in the US conducted a double-blind, placebo-controlled trial with 159 stroke patients with major depression. The patients received 600 or 900 milligrams of nefiracetam or placebo within 10 days to 3 months after a stroke. The trial ran for 12 weeks, with the patients evaluated at 4, 9 and 12 weeks of the trial, and the study concluded nefiracetam produced a significant improvement in the most severely depressed patients. Much of the research on nefiracetam has been done with learning and memory in mind. One study conducted in Ireland used nefiracetam with rats. Scopolamine, a memory inhibitor, was given to the rats while they were in training. Scopolamine is used to purposely inhibit memory. When the researchers gave the memory-deprived rats nefiracetam, task recall improved and significantly improved memory deficits. Another Irish study with rats showed 40 days of nefiracetam supplementation induced nerve growth factor and neurogenesis, proving that the nefiracetam could facilitate long-term memory consolidation. Supplementing with nefiracetam is reported by many users to boost motivation and a get-it-done attitude, which is the opposite of apathy. Stroke patients who suffer depression commonly experience apathy. Researchers at the University of Iowa conducted a study with 137 stroke patients with major depression, 70 of which also met the publicized diagnostic criteria for apathy. The patients were assigned a placebo, or 600 to 900 milligrams of nefiracetam per day for 4 weeks. The patients who used 900 milligrams of nefiracetam had a significantly greater improvement in the apathy scale score compared to the other two groups. Recommended nefiracetam dose is 100 milligrams to 900 milligrams per day, taken in divided doses, 1 in the morning and 1 in the early afternoon. Nefiracetam is sold in tablets, capsule and powder form. Tablets are usually 400 to 600 milligrams each. Since nefiracetam is fat-soluble, you should take it with a meal containing healthy fats. Nefiracetam also boosts acetylcholine in the brain. To avoid a racetam headache, make sure to take the nefiracetam with a good choline source like CDP choline or alpha-GPC. Most studies suggest, and many user reports say, it needs to be taken for at least 7 days before you experience the full benefits. Nefiracetam is non-toxic, so it's considered well tolerated and safe. Side effects are rare, but they could include anxiety, fatigue, headaches, nervousness, and nausea. Side effects are often a result of an unusually high dose. Headaches from using the nefiracetam typically only happen when you forget to combine it with a good choline source. A headache is a symptom of a choline deficit in the brain. Nearly all of the toxicity studies on nefiracetam have been done on animals, and prolonged use of this nootropic has shown no toxic effect at the recommended dose. One study with male beagles reported a reduction in testicular testosterone after a single treatment. However, the dose used in this study was ridiculous at 180 to 300 milligrams per kg, which is equivalent to 16 to 27 grams of nefiracetam for a 200-pound male human. Dogs happen to metabolize nefiracetam differently to humans and primates. The metabolite M18 in dogs seems to be the culprit, and it's not found in humans or monkeys. Your body doesn't make nefiracetam on its own, so to get its benefits it needs to be taken as a supplement. It's especially helpful for people who are suffering from apathy, loss of motivation, and memory loss. Studies show it helps to stop and reverse the symptoms associated with apathy. And this nootropic helps to boost the activity of GABA, glutamate, and acetylcholine, all involved in long-term potentiation and the formation of long-term memory. Nefiracetam is also particularly useful to students and executives who want to boost cognition, learning, and especially long-term memory. Experience using nefiracetam shows it helps to boost study scores, workflow, learning, and memory. You should use nefiracetam with a good choline supplement like alpha-GPC or CDP choline. It boosts neural acetylcholine, so it demands the presence of more choline in the brain. You could safely boost your intake of Nefiracetam to 1,200 mg per day. The doses should be divided twice per day, one in the morning and one in the early afternoon. For more information on nootropics, herbs, supplements, or natural treatment plans, check out my website.